Hello, and welcome to Project Parents United, a unique platform where we discuss children's health issues, parenting issues directly with professionals that take care of our children. Today, we talk about stress and how we can help our children manage stressful situations and build resilience. We know babies and children are highly intuitive. So, if as parents we're stressed and anxious, how does that affect our children? To learn more about this, I reached out to Dr. Niranjana Rajan, who is a pediatrician, a mommy of two, and she's been practicing for over 25 years. She's also the owner and founder of Lanesboro Pediatrics in New Jersey. Let's see what she has to say about this topic.
Hi, Dr. Rajan. How are you?
How are you doing?
I'm well, Dr. Rajan. Thank you so much for joining me today. As you know, we are going through some very unusual times, and as parents, we often feel stressed and anxious about what lies ahead. And I've often wondered, do children and babies also feel stressed? And if that's the case, how can parents identify this early on?
Yes, of course. All human beings express stress and anxiety. People don't realize that even babies do. Some ways to recognize in babies is, of course, them crying more, fussing more. Babies' heart rates go up, their blood pressure goes up. And in order to be soothed, babies need to be held, or they like to suck, using a pacifier or sucking on their finger helps reduce their blood pressure and their heart rate. Toddlers and other children can exhibit symptoms such as crying more, being more clingy, having trouble sleeping. A child that used to sleep alone maybe is not able to anymore. Mm-hmm. Older children, of course, will be a little bit more expressive. They can also be difficult in maintaining your schedules and not willing to eat or sleep or bathe when they usually would. All children, babies, toddlers, all children, they look at their parents. They're watching us. They're watching you. They're watching your face. And they're reading your body cues. And the best way to reassure your child is, even if you are anxious, to try and put on a smile and be more encouraging.
Wow, this is an eye-opener. Honestly, I didn't know that babies felt stressed until I started reading more about it. So I'm sure a lot of parents that are listening to this right now are feeling some comfort that at least they know how they can identify signs of stress and anxiety in their babies and children. But I also wanted to ask, what is it that causes our babies and even children to get stressed? What are some causes?
I don't think parents or adults think about this, but babies, depending on their cognitive and intellectual state, different things cause them stress. So a newborn infant is actually very stressed about where their next meal is coming from. Cognitively, even though parents are up all night feeding their babies every hour, every 2 hours, when that baby is hungry, he or she feels extreme stress and cognitively does not know where that next meal is coming from. And so being hungry is very stressful. Being wet is very stressful. Not knowing how to soothe themselves is very stressful. Having come from the womb where they were held constantly for 40 weeks and rocked to now being born and being out in the world is very different. As babies get older, parents will see and realize that their little one now knows what's going to happen. When mom or dad gets ready to feed them, they may calm down and give you a few minutes to get settled into your feeding routine. And that is really amazing. And we can see that even in 2-month, 3-month, 4-month-old babies. So for the young infants, it's all their basic needs: hunger, cleanliness, warmth, comfort. These are the things that cause baby stress.
I see. And with children, some causes, could it be just parental anxiety, as you mentioned, maybe schoolwork, like some other causes that you could tell us about?
Sure. With older children, school-age children, there is so much going on right now. Their lives have changed dramatically. Although I suspect that many young children are really enjoying being with their parents all the time, it really is not always fun and games. Parents have work to do. They have to work from home or do other things. There might be a lot of uncertainty at home. What if a parent has a job that cannot be done from home? Yep. What if they have a job they have to go in, and then there's a fear of coming back and getting sick, or even worse, a job that, they were laid off, in an industry that right now we are not able to have open. So there could be financial stress, which definitely is there. There is emotional stress, fear. There's so much fear about getting sick, or maybe there are loved ones who are sick. So children really see all that, and now they're with their family 24/7, and depending also on their environment, how big is your home? How many rooms do you have? Do you just have one room to work in or two rooms? All of those things, affect their emotional stability. They're not able to go to school. As you mentioned, online school, probably cool in the beginning, but most schools are not doing synchronous learning. It is asynchronous. I hear that many schools, they check in with their students for about a few minutes and then send packets of work, which actually is stressful for the family because the parents have to oversee this. Can't have a first year, like the first grade or second grader, just absorb new material and do work on their own. So that also can be a point of stress.
I see. Children at all times, they are very observant. Just as resilient they are, they're just little sponges. They are absorbing what all is happening in their environment. Now, do you think, is it fair to say that some children are just better or they're just better at handling stress? Or is it something that we can teach all our kids?
That's a good question. So of course, yes, personalities and natures vary. Infants, even in utero, have different behavior patterns, and babies definitely, some are more easygoing, some are more sensitive. And so yes, they have that personality, but I think parents can greatly teach and influence their child based on how they are managing their stress. Like I said, infants are looking at their parents' faces. So if a parent's face is sad or stressed, they will see that. So they do respond to smiles. Older children, it depends on the age group. I think it's okay to talk to your school-age child that you might be worried, that it's hard working from home. You're worried about maybe grandparents. I think it's okay to talk about those things. Talked about some concerns. It's also good to counter that with positivity. There is reassurance they need. There's so many wonderful things that people are doing in this time, helping each other, thanking each other. There's so many stories of resilience and strength, and we need to tell our children about those things.
There's just so much information available about the current events these days, and it only adds to their stress and anxiety. How do we communicate the message of hope when times are just so uncertain?
Right. So I guess with school-age children and above, adolescents and teens, even though they're spending so much time on computers and internet, I think we have to limit that. We have to limit that exposure. And I think many of adults have said that even they can only watch so many minutes of the news, that it is very stressful. So I think we have to limit that exposure, but it's okay to have the news on a little bit, and you should watch it with your child, and depending on their developmental stage, explain what's happening. But I would keep it to a minimum. And then also maybe tune into programs or articles that show about people who have gotten better, survived, helped their neighbors. So many people are thanking healthcare workers and other essential workers. I think it's really important to talk about those things to counter the negativity and, the fear that's there.
Right. And that message of hope, like you said, is so important. This is a time when we have to be kind. And what better time to tell our children that times will be better? We need to look out for each other. Yeah. So I really like those points, Dr. Rajan.
Yes. One other thing I'd like to say is that also engaging your child in doing something that may be helpful. I've actually had several young patients send us pictures and thank yous. And, it is just so uplifting. So, they could, send a card to a neighbor or family member, or just, put up signs and, paintings to recognize other people that are being helpful. So I think engaging them in some activity, right, especially the younger ones, is very important.
And this is so true. What a great message for parents out there. Simple things just go a long way.
We hope you found this information useful, and don't forget to tell us what you think. You can also connect with us on Instagram, Facebook, and YouTube, or visit us at www.projectparentsunited.com.